Hey there. Being a new parent is, well, it's a journey full of surprises, right? Today, we're going to talk about one of those things that might catch you off guard at first, but is actually a totally normal, even fascinating part of your newborn's first few days.
So imagine this. You're on your 10th diaper change of the day, and you see a little bit of blood. I get it. Your heart probably skips a beat. But really, take a deep breath. We're going to break down exactly what's going on, and I promise, it's almost certainly nothing to worry about.
All right, so the whole reason for this little surprise comes down to hormones. It's actually a pretty cool story about the incredible connection between you and your baby, and how their tiny body is already making these huge adjustments to life outside the womb. Okay, so the official medical term for this is physiologic neonatal vaginal bleeding. I know, it sounds complicated, but the most important word there is physiologic. All that means is that it's a normal function of the body. It's not a disease, not a problem, just a temporary thing with a very clear cause.
So here's the science behind it, and it's actually pretty simple. While your baby was cozy in the womb, she was getting a steady stream of your hormones, especially estrogen. Totally normal. But then, after she's born, that hormone supply line gets cut off. Her body notices this sudden drop in estrogen, and it responds by shedding a tiny bit of the uterine lining that had built up. Honestly, you can just think of it as a little mini period. So the main thing to remember is that this is what's called a benign and self-limited process. Benign just means it's harmless, and self-limited means it stops all on its own, no treatment needed. Far from being a bad thing, it's actually a sign that your baby's body is working exactly as it should, making that healthy switch to life on the outside.
Okay, now for the really practical stuff. How do you know for sure that what you're seeing is the normal thing we're talking about? Don't worry, we've got a super simple checklist to give you some peace of mind. So on one hand, you have normal bleeding. This happens in that first week. It's just a tiny amount and it's over super quick. The biggest clue? Your baby is totally fine otherwise, eating, sleeping, and being her cute self. Now, on the other hand, you should definitely give your doctor a call if the bleeding seems heavy, if it keeps happening, or if it lasts more than a few days. Also, watch out for any other signs that something's off, like a nasty discharge, a fever, or if she just seems unwell. This chart is your go-to guide. And let's just double down on that timing. We're talking about a very brief event. Usually, it's all done and dusted within 1 to 2 days. Seriously, it's one of those blink and you'll miss it things. Knowing that it's so short-lived can really help dial down the anxiety. Right, so you've looked at the checklist, you've taken a breath, and you've figured out what you're seeing is totally normal. So, now what? What are you supposed to do about it? Well, the answer might surprise you with how simple it is. The best approach, the recommended approach is, well, pretty much nothing. It's all about education, knowing what it is, and reassurance, knowing it's okay. You just keep doing all the wonderful standard newborn care you're already doing. That's it. Maybe mention it at your next regular checkup with the pediatrician, but no special action is required. And this is just as important, knowing what is absolutely not needed. You don't need to rush out for a pelvic ultrasound. You don't need any lab work or blood tests. And you definitely don't need a referral to a specialist. The guidelines are really clear on this, and it's all about preventing unnecessary tests and stress for you and your baby. So, as we start to wrap this up, I want to leave you with one final thought, a powerful message that really brings everything we've just talked about into focus. This quote, right from the clinical literature, just says it all, doesn't it? A benign, self-limited condition that requires only reassurance and routine newborn follow-up. That's not just my opinion. That is the medical consensus. So let those words really sink in and bring you some comfort. So maybe instead of seeing it as a moment of worry, we can reframe it as a moment of pure wonder. It's this tiny little window into the incredible, complex things happening as your newborn's body adapts to this big new world. It kind of makes you wonder, right? What other amazing adaptations are happening right under our noses?